Hello, Mrs. Smith.
Hello.
Is it okay with me calling you Mrs. Smith?
Yeah, that's fine.
Okay, my name's Caitlin.
Nice to
I'm
meet
the
you.
social worker here at the psychiatric hospital. And I see here that you were just admitted last night, so how is it going so far with your, here, are you finding everything okay? And
Yeah, I mean, that's not really the problem. It's, the family that's at home and,
right,
I really worry about them a lot, so this is a little difficult to be
yeah,
away from them like this.
for sure,
So.
yeah. I know it says here you have 4 kids, is that right?
Yes, yes.
Okay.
Mhm.
Okay.
Yeah, they're all in their teens-ish, and then I have one smaller one, so it's really tough to know that they're all by themselves.
Right, for sure. Were you able to did they give you enough time to get somebody to look after them?
Yeah, I think my mom, and she came in.
Okay, so that's
So.
good. Yeah.
Yeah.
All right. Well, I have some good news and some not so good news for you on that point. The good news is that that's what we're doing here. My goal as a social worker, I'm totally working with you. We really want to get you out of here as soon as possible and back into your regular life with your kids. So that's the good news, is that that's what we're working towards. If you're okay with that, if you're okay with working with me.
Yes.
And so the not so good news is that we're here for a week, is what it says on your report. So we do have a week to look at how we can maybe help you when you're actually back into your life, and work on maybe some troubles that you're having back home. And so basically what this is we're going to have 3 more sessions this week. They'll probably last about 30 minutes to an hour. And our goal today is we're going to make a goal today. So I'm just going to learn a little bit about you and just kind of try to figure out maybe in some ways we can help and make it easier for you to get back and maybe have a little bit better time of it. And so I just want to really get it out there. I know I'm asking you to be really honest with me so that we can help you, but I'm going to be really honest right now. I'm going to tell you a few things about the policies that we have. And so obviously I'm sure you've heard this before, but if you say anything like you're going to hurt anybody or if you're going to hurt yourself, I have to report that to my superiors. I'm also going to be really just open book, and we are being videotaped right now. But basically, those are all over the building, obviously for you all's protection as well as mine. We just really value y'all's integrity as well as our own. And on that note of integrity, you have the right, if I ask a question today, just in trying to figure things out that you're uncomfortable with, I want you to just really feel free to not answer. If you don't feel like it's relevant to what we're trying to do, then that's absolutely fine. So are you okay with all those things?
Mm-hmm.
Is that all right?
Yes.
Okay. So like I said, today we're basically trying to figure out a goal for when you do get back into your regular life that maybe be able to help a little bit. So it says here that you overdosed on aspirin. Do you want to maybe tell me a little bit about that? What happened? Is that correct?
I think technically it's correct, but
Yeah.
that's not really how I view it.
Right.
I have a very difficult life,
Mm-hmm.
and taking care of my children and my husband and his problems, and so an aspirin every once in a while is needed, I believe.
Right.
Just to calm down a little bit, get rid of the headache,
Mm-hmm.
and so it's been that way for a while now. But I guess this time it was too much, is what they said.
Mm-hmm.
So.
Yeah. Unfortunately, those things can be really black and white, and
Mhm.
especially on paper,
Right.
the story behind it can be a lot more complex than just a blanket,
Mm-hmm.
So I heard you have your 4 kids, and then your husband. So how is your family life like when you're at home? How is that?
It's a little chaotic because
Mhm.
they're everywhere. It doesn't really help that my husband has been in and out. We've had our problems. We've been separated for about 3 different times now or so. He has an alcohol problem and is trying to get treatment, so it's very difficult when he's not there, but it's also very difficult when he is there. And so we are just having some problems figuring all that out too.
Yeah. So I'm sure when he's not there, a lot of the responsibility falls on you.
Mm-hmm.
With the kids, is it a really busy schedule that you have, or how is that?
Yeah, I mean, it's busy, but it's kind of the way I grew up too.
Mhm.
So always taking care of everybody, it's been just kind of natural to me.
Mhm.
And maybe it's been too much, but that's just the way it is, I guess. I don't have a job, so I stay home and
Mhm.
take care of them all the time.
Mhm. Is that something that you enjoy, taking care of them?
I do, yeah. I enjoy taking care of my kids,
Yeah.
but sometimes it'd be nice to have a little help
Yeah.
or some free time.
Right. For sure.
Mm-hmm.
So you mentioned that it's a lot like how you grew up. So did you have a lot of siblings, or was it a really kind of that same chaotic kind of feeling around your house growing up?
Yeah, I had 3 other siblings, so there were 4 of us, and I tended to care for them a lot
Mhm.
since my parents got divorced when I was young as well.
Mhm.
So going through that was tough, but it was like I just put everybody on my back and carried them through it, you know.
Right.
So it was a difficult childhood for a while, yeah.
Yeah. I've heard of that a lot, that it's really hard for the kids in a divorce situation.
Mhm.
A lot of times people feel like they have to take on responsibility for the family.
Mhm.
So are your siblings, were they older than you or younger than you?
Yeah, I had 1 older and then 2 younger, so I was right in the middle. But my older sibling was a boy, and so he didn't have that motherly instinct, you know.
Right.
And so my father, he was also an abuser of alcohol and was in and out. And then my mom, you know, they divorced, and she became abusive, I think, because of her anger,
Mhm.
and it was abusive towards us. So it was like I kind of needed to step in and be the loving of the mother.
Yeah, that's a lot of responsibility for a young kid, really.
Mm-hmm.
I'm sure that was really difficult to get through. So, do you feel like you fear that your kids will have that same experience? I know with your husband in and out, is that something that you struggle with, just kind of seeing your repetition of, it's just that much more stressful because you
Mhm.
don't want that to be
Right.
their lives?
Yeah, I definitely do fear that being the outcome.
Mhm.
And I think that's why we haven't divorced yet, and we've just been separated,
Right.
because we don't want to resort to that. But
Right.
there is a point where it's
Yeah.
a little much to handle. So,
Yeah. Considering the health of yourself
Mhm.
as well as the kids.
right.
Do you feel like, because I know that this week we're mostly focused on you, but do you feel like even something for the kids would be helpful maybe when you went back? Are they involved with like sports in school or any kind of support group already, or is that?
They're not too
Okay.
involved with groups, but
Mhm.
sports, yes.
Okay.
But yeah, I think it would be good to talk with them, either
Right.
me or you, but
Mhm.
just so they can understand this situation a little bit better.
Yeah,
And
for
then-
sure. I know because I can see that you're really have a very full heart, very caring, and I know that that's probably on your mind just as much as you said. You know, you're thinking about them while you're here, and I feel like helping you would probably include helping them as well. So, yeah, we can start there, definitely, when we're building our goal. So what I'm getting from you a lot is that you have a lot on your plate. So you're taking care of a lot of people, including your kids and your family. And so, and I noticed that you mentioned that you don't have a lot of time maybe to yourself. Would that be an accurate, I guess, assumption?
Yes.
And so maybe that's something that we could work on as well. Would you feel like it would be realistic to maybe look at your schedule and figure out a night or an evening, whatever that would look like, just for you to go out with either like a support group or maybe friends, maybe just time to yourself? Does that sound like a realistic thing for you, for your life, your schedule?
I think so. I think we could probably find maybe a day. I don't know about many more than that. But
Right. But I feel like especially, because it really just sounds like you were kind of overwhelmed. It doesn't really sound like the overdose was necessarily a problem in itself in terms of like medicine abuse, things like that. It sounds like it's more of a just you were kind of had a lot on your plate. So basically, I feel like now, would you feel like the one time a week for yourself, as well as maybe getting the kids into a support group, would that be a good maybe goal to work towards this week?
Yeah.
And our time together, just kind of figuring that out.
Yeah, I think I could probably get a couple of them in to some kind of support group.
I know the younger one, maybe not so much right now.
Yeah.
But I think definitely teenagers, it's probably a really important thing for them. So with that goal, basically, I'm sorry, I'm looking down on my notes just because I'm trying to remember things that we need to go through, and thinking about steps. So basically, after we leave here, because I know we only have a few more minutes, but if we could, maybe if you could think about your schedule, write down, I would encourage you to write it down on a sheet of paper sometime when you have some free time, just in terms of anything you can remember with like kids, possible sports, maybe practices that they have, days, you know this better than I do, that it's just really a lot more hectic than others, and I would encourage you to bring that with you for our next time together, which I believe is in a couple days. I think we have a day in between. So if you could bring that, we can look at that. So that'll be something that you can do. And then I will definitely look into, I know I was already kind of considering, we always consider a support group for our clients after they leave. Because if progress isn't made back at home, then this was basically useless. And so I was already kind of starting to think about different places for you, but I'll definitely relook at that, and as well as for your kids. I'll make sure to maybe look into that, as well as talk about, you can be thinking about any kind of, I don't know if you're a religious affiliation at all, or different if your kids are really, like you said, they're into sports, so maybe like an activity-based program. So if you could just be thinking about that, and then I can develop a list throughout the week, and we can kind of think about what would be good for you. Is there anything I need to consider in terms of like transportation or anything like that? Any exceptional circumstances?
I don't think so.
Okay.
2 of my boys are older than 16, so they can drive.
Okay.
So it'll be fine.
All right. Do you think that that's something that they'll be open to, going to some kind of program or
I think possibly,
activity?
yes.
Okay.
Maybe just to feel it out, and then from there decide whether or not it's for them.
Right, because I know especially if they're 16 and they have driver's license, we're starting to get into a little bit more of their ballpark, if you would pardon the analogy. And so yeah, I would just encourage you to look at the schedule for this next time and just be thinking about possible scenarios that may work out. I don't know if you have a friend base or if we need to think about a support group. So if you just be thinking about that, and then we'll get on different support programs for you as well as possibly your kids. And so that's for next time. So that'll be our first steps towards doing that. Does that sound good to you? Is this all kind of with your blessing? Because I know that you are the most important party here. So that sounds good. So this definitely, I feel like we've kind of gotten somewhere. How do you feel? How do you feel right now? Are you feeling pretty good?
Yeah, pretty good. Good start.
Okay.
Yeah.
Well, I appreciate you coming here right now. I know that you probably have some place to go for your next appointment, and I will see you in a few days. But be sure I can write down on a piece of paper. I'll get it for you at the reception desk. But with my name and my phone number, I know I'm the social worker on call most of the day. So if you ever need anything, we really want to make sure that everything goes smoothly when you're here. So if you ever have any questions about any one of the staff members or anything you just want to talk about, make sure to give me a call.
Okay.
Or if you just want to know what the best dessert is at the food line, their brownies are delicious. But anything you need, I'm totally here for you here and then afterwards. So
Okay.
I really appreciate you coming, and it was very nice to meet you, Ms. Smith.
Thank you.